Hello, everyone. Welcome to week 2 of our Tickborne Boot Camp here at Vibrant Wellness. I'd like to take a minute to introduce you to Dr. Myriah Hinchey, who's going to be doing our week 2 presentation today with naturopathic approaches to Lyme disease. And Dr. Myriah Hinchey is a licensed naturopathic physician from Connecticut, distinguished by her fellowship in the Medical Academy of Pediatric Special Needs, or MAPS. She proudly serves as the owner and medical director of Tao Center of Vitality and Longevity and Optimal Health, suited in Hebron, Connecticut, where she has achieved notable success in her integrative medical practice. With a career spanning over 17 years, Dr. Hinchey's unwavering passion revolves around the integrative treatment of complex medical conditions encompassing tick-borne disease, autism spectrum disorder, toxicity, and immune system dysfunction. Her expertise extends to both adult and pediatric populations. Following her naturopathic medical education, Dr. Hinchey embarked on a continuous journey of learning under the renowned functional medicine pediatrician, Dr. Nancy O'Hara. During this transformative period, she learned the intricate link between Lyme and tick-borne diseases present in the possible underlying factors of children with autism spectrum disorders and PANS-PANDAS. Expanding her knowledge in diagnosis and integrative treatment of tick-borne diseases, Dr. Hinchey sought guidance from the International Lyme and Associated Disease Society, or ILADS, and she remained a dedicated member for over a decade. She furthered her expertise by mentoring with Dr. Tom Moorcroft and obtaining her certification from Dr. Richard Horowitz and Dr. Neil Nathan. Additionally, she completed her certification in mycotoxin illness under the guidance of Dr. Richie Shoemaker. Dr. Hinchey's approach to treating tick-borne diseases is profoundly influenced by her wisdom of functional medicine and lifestyle medicine luminaries such as Dr. Jeffrey Bland and Dr. Mark Hyman. Intriguingly, during this period, Dr. Hinchey herself received a diagnosis of multiple tick-borne illnesses. When years of pharmaceutical treatments proved ineffective, she turned to master herbalist Stephen Bruno, evidence-based herbal approach for healing Lyme disease and its co-infections. This collaboration led to her development of the groundbreaking products and treatment protocols that not only aided in her own recovery, but also brought relief to numerous family members, including her mother and son, and consistently benefited her patients. Beyond her clinical work at Tao Vitality, Dr. Hinchey is a driving force behind Lyme Core Botanicals, a respected herbal medicine company specializing in tick-borne diseases. Lyme Core takes pride in sponsoring numerous continuing education events on tick-borne diseases and reinforcing its leadership in the field. We're so excited to have Dr. Hinchey with us today, so I will go ahead and hand it over to her so that she can get started.
Thank you, Dr. Bruno. I am very excited to be here with you all and share some of my approaches to Lyme and other tick-borne infections. So I thought it would be helpful maybe to start with dispelling some common myths. So I'm going to go through these pretty quickly because I don't know the level of Lyme literacy here with everyone joining us. But I just want to hit the highlights. So only deer ticks transmit Lyme disease. This is false. And while the black-legged tick or deer tick is the primary vector, there are other ticks that also carry and transmit Lyme disease as well as other co-infections. So myth number 2, a bullseye rash is needed to diagnose Lyme disease. So this is completely false. The bullseye rash is only present in anywhere between 20 and 40% of diagnosed Lyme cases. And this rash can take anywhere from 3 days to 4 weeks to appear. And a lot of times it does not look like a bullseye. So it can be many different shapes, sizes, even colors. It can look like bruise. And the bullseye rash definitely is not present in other co-infections. Now, if you see a bullseye rash, it is diagnostic of Lyme disease. So no matter what any test says, if you have a true erythema migrans rash, that is diagnostic of Lyme disease, no matter what your test says. All right. Myth number 3, if the tick is removed within 24 hours, you can't get Lyme. This is false. So, there are various rates of transmission. And one of the most important things is that if the tick were attached to another animal and it were removed while it was feeding off that animal, that tick would be partially fed. And what happens is the spirochetes live in what's called the hind gut of the tick. And once the presence of a blood meal enters the tick, that stimulates the spirochete to move to the salivary glands. Once it's in the salivary glands, it can be transmitted to its new host. And so this whole process takes 24 hours, which is why they say if the tick was attached for less than 24 hours, you can't get Lyme. So if that tick were already feeding on something else, and let's say it was scratched off, and now that tick gets onto you, the spirochetes would already be in the salivary glands of that tick. And when that tick injects its saliva into you, it's going to transmit the spirochete. And the case study that I'm going to do at the end today is a perfect example of this. Other co-infections have various transmission times. The Powassan virus, for example, can be transmitted in as little as 15 minutes. So we cannot just rest assured that, oh, I know that tick wasn't there an hour ago, therefore I could not have have gotten any of the pathogens that it carries. All right, number 5, all Lyme cases are acute and easy to diagnose. I think most people know this is false, and you probably wouldn't be here otherwise. Next, standard Lyme tests are accurate. So this statement couldn't be more false. When we're looking at conventional laboratories, not only are they typically only looking at Borrelia burgdorferi, and sometimes now Miyamotoi, but they are only looking at certain proteins, and they have kind of like a hard and fast whether that protein, that Katie band, is going to report reactive or non-reactive. And so, we all know that this is an infection that suppresses our immune system's ability to function and causes immune dysfunction. Yet most of the tests that we're using are indirect tests, meaning we're looking at the immune system's response to the presence of the infection to actually, aid in that diagnosis. So standard Lyme tests are not accurate most of the time. Okay, next myth. A few weeks of antibiotics will cure Lyme disease. Maybe, right? We don't know. I don't like the word cure. I always say if you're going to use the word cure, you better have some pretty serious proof that it is completely eradicated from the body. If you get on antibiotics and, the antibiotic of choice is doxycycline within the first 3 to 4 days of when that tick attached, you have the best chance, if you remain on it for 4 to 6 weeks, of completely eradicating the infection. If it's been several weeks before antibiotics have been started, or if we are dealing with a chronic Lyme case, then this statement is absolutely false. And different co-infections, like for example, Babesia, you're not going to be able to use an antibiotic because antibiotics kill bacteria, and Babesia is a parasite. So you actually have to use antiparasitics. Only people in the northeastern United States are at risk for Lyme disease. This is false. So Lyme has been found in all 50 US states and in many other countries around the world. You cannot have Lyme disease if you don't remember a tick bite. So most people diagnosed with Lyme disease do not recall a tick bite. And, the ticks that are notorious for transmitting these infections, nymph ticks, are about the size of a poppy seed or smaller. And when they're in the larva stage, which does carry infections, they are actually translucent. So they're more like this skin color, and they are very, very easy to miss even during tick checks. And if they are in your armpits or your groin or in your hair, they're going to be super, super hard to see. All right, and then Lyme disease is only a joint disease. So this is so false. We can have neurologic, cardiac issues, as well as systemic, immune dysfunction, and a lot of neuropsychiatric symptoms occur with Lyme disease. I always say Lyme infects every single cell in the body, and therefore it has the potential to affect every cell in the body, and therefore every system in the body. Okay. Lyme disease is the only illness transmitted by ticks. So obviously this is not true. We have a variety of pathogens, including Anaplasma, Babesia, Bartonella, Ehrlichia, Powassan virus, and many others. If you're treated for Lyme disease and you still have symptoms, you must have another condition. So this is false. The reality is some people can develop a set of ongoing symptoms that are being called post-treatment Lyme disease syndrome. And honestly, I don't really like this terminology here. I think that there are some people who might have an ongoing, immune issue or inflammatory issue after the infection has been dealt with. But honestly, I think that most of it is still an active infection that will get better with treatment. And lastly, there's no such thing as chronic Lyme disease. So this is false. The CDC finally has somewhat acknowledged this. They are not going as far to say as, you know, chronic Lyme exists, but they are saying that there are chronic symptoms from Lyme disease. But at least it's a step in the right direction if you care what the CDC thinks about Lyme disease. All right, so symptoms of Lyme. Like I said, Lyme infects every single cell in the body, and therefore it's going to affect every cell in every cell system. I would say the most common symptoms of Lyme disease are fatigue, headaches, stiff necks, muscle pain, joint pain, cognitive issues, neuropsychiatric issues, sleep disruption, sweats, chills, dizziness, sometimes sore throats and swollen glands, a lot of time nausea. And so I want to point out that, it's very important not to just dismiss everything as a flu or a cold. One of the most common presentations of an acute Lyme infection are flu-like symptoms. So, if you've tested negative for the flu and it's not a typical flu and you've had a tick bite recently that you know of, super, super important to rule out or rule in and treat Lyme disease. I would say one of the hallmark symptoms of Lyme disease is that it's like progressive worsening of the immune system. And also the symptoms are intermittent, meaning that they come and go, but they're cyclic. So, according to the CDC, Lyme is the fastest growing epidemic that we've been faced with, and it should be diagnosed based off of three things. Number one are symptoms and physical findings. Number two is the possibility of exposure to infected ticks. And then number three, it says laboratory tests are helpful in diagnosing Lyme disease when you use validated methods. So this clearly, even from the CDC, does not mean that Lyme disease should be diagnosed based on a positive or negative test, which is almost often the case. I cannot emphasize this enough. Lyme and tick-borne diseases are clinical diagnoses. And we have to do a really good job of looking at the patient in front of us, looking at their symptoms, looking at the physical findings, and looking at other laboratory markers that evaluate the immune system and inflammation, as well as looking at not just a positive or negative on a Lyme test, even with a specialty lab, we need to really learn what these tests are showing us. And we have to learn how to interpret the results and look at the immune response to the various bands and looking at it as almost like evidence to support or aid in our clinical diagnosis of Lyme. Okay, so key points to remember. If that rash is there, it's diagnostic for Lyme. There's no need to test. But if it is not there, that does not mean that it's not Lyme disease. Testing too early can give a false negative. So peak antibody production is in 3 to 6 weeks. For IgMs, it's around week 3. For IgGs, it's week 6. And if you test for Lyme right after you sustained a tick bite, you're most likely going to be negative, even if you're using a specialty lab. You can only get results for the specific species of Borrelia that the test is looking for. So we can't just test for Borrelia burgdorferi and then apply that to the 20 other species of Lyme disease. Testing for Lyme does not test for co-infections. So it is important to look for all of these individual co-infections as well. And also, we should be looking at other laboratory findings that might be useful in your diagnosis, like immune function and inflammatory markers. Okay, so I deal a lot with chronic Lyme and other chronic tick-borne diseases, and I really want to point out that it is immune dysfunction that is often behind the disappointing clinical outcomes. So Lyme and co-infections know how to disable the immune system's ability to recognize and target the infection, which leads to an ongoing inflammatory response, which increases the invasion, proliferation, and immune suppression. So, signs of immune dysfunction in Lyme could be total white blood cell counts being low, decreased lymphocyte percents, decreased natural killer cell counts, decreased immunoglobulin levels, impaired T cell reactivity, and a persistent disease that responds poorly to the medications that would typically work to treat it. Signs that Lyme has activated the cytokines is everything. Pretty much every symptom and every dysfunction of systems is caused by inflammation. I would say the most typical are malaise, fatigue, aches, pains, cognitive impairment, neuropathy, arthritis, and more. So Lyme disease persists because it gets the immune system of the host to work for it instead of for the host. And this happens in both the acute and chronic phases. Now, when that tick bites and it puts its saliva into the body, the tick saliva actually has various chemokines that push this inflammatory cytokine cascade and actually make the immune system weaker and help to support the existence of this infection. So together, the tick saliva and the infectious organisms manipulate the biochemistry of the body using various enzymes to degrade the connective tissue matrix to feed themselves, as well as alter the immune system. And together, that makes the body hospitable to the infection. So you're going to hear me talk a lot about making the body inhospitable to the infection and healing the body, as opposed to just focusing on killing this infection. Obviously, we need to focus on killing the infection, but that's just part of the puzzle. All right. So, in my opinion, many treatments fail when the focus is on killing the organism instead of healing the patient. And so, what I mean by this is that we're not addressing the root causes that are making the patient hospitable, keeping the patient from healing, and ultimately inhibiting the elimination of the infections. So, I will argue that Lyme and tick-borne disease will make further underlying root causes. And we need to figure out what those are, because Lyme will prey on an individual's weaknesses. So whether it's genetic weaknesses or it's previous injuries, Lyme is going to basically prey off of that and result in different pieces of the puzzle for different patients. So we cannot rely on antibiotics alone to eradicate the infection, because this infection is a lot smarter and knows how to hide. And in the end, no antibiotic is going to completely bring this infection to zero. It's the immune system that has to either force it into remission or, force it into remission or stop it from replicating or completely get it out of the body. So we have to focus on normalizing the immune system ultimately. That is goal number one. while making the body inhospitable to the infection and healing the body while we are shrinking that infectious load to the point where the immune system can handle it. So I think this point is worth saying again. There's no combination or amount of antibiotics or length of time being on antibiotics that is going to completely eradicate the infection. It's the body's immune system that has to eliminate it or put it into remission. So, antibiotics definitely have their place. I am not against antibiotics. I am somewhat against long term antibiotic therapy. But every patient is different and every patient requires a different approach. In general, I will say excessive long term antibiotics can cause further immune dysfunction by disrupting the microbiome. We know that a majority of our immune function and ability to control inflammation comes from our good, healthy bacteria and a balanced microbiome and a fully functioning gut. And if we are causing dysbiosis, we are increasing gut permeability, which is going to increase our overall toxic load and burden, which leads to impairment of organs of detoxification and elimination. It can alter our nutrient intake and digestive capabilities. And also, antibiotics can trigger the formation of persister cells, and antibiotics are not going to treat persister cells. So, again, we cannot just rely here on antibiotics. So, how do we treat an infection that needs to be eliminated while restoring proper immune function? And my answer to this is, it's not a one size fits all. There's no protocol for this, but I do believe that there's an approach. And so that approach has to include a full investigation of the terrain of the individual. And we need to find out what pieces of the puzzle have been altered in that particular patient. And then we have to go after them pretty much all together most of the time. So Lyme creates a perfect storm. We have this inflammatory cytokine cascade resulting in immune dysregulation. The presence of a lot of these proteins from the spirochetes are going to stimulate enzymes that break down collagen and the extracellular matrix that allow these infections to feed off of our tissues. It causes elevated galactin-3 levels, which is a pro-inflammatory kind of upstream alarmin that keeps calling inflammation and immune cells in. It leads to increased intestinal permeability because of the gut inflammation. It leads to increased toxicity, not just the biotoxicity, like from these organisms themselves, but because our bodies become less efficient at detoxifying the toxins that we make and that we are exposed to. We have the formation of biofilms, and then we have eventual impairment of organs and organ systems. And so a lot of us like to think about this in a linear model, and this is how I used to think about it. And it would be nice if we could address each one of these one at a time. But the reality is that it really looks like this hornet's nest. It's a complex pathophysiological series of interactions, and we have so many of these downstream issues feeding back in upstream and just kind of like perpetuating this giant ball of wax. So in order to make the body inhospitable, we have to look at all of these things that make the body hospitable. And yes, it is being driven by the underlying cause of the tick-borne infection. But these infections, again, are preying on the weaknesses and causing further underlying causes. So these dysfunctions are intermingled and they need to be dealt with simultaneously almost all the time. So inflammation is really the driving force. So this is an inflammatory infection, meaning that it causes inflammation and the symptoms are caused by inflammation, but it also is going to feed off of that inflammation and cause further immune dysfunction using that inflammation. So it's really inflammation that's making the body hospitable to the infection. So I want to stop and just hit some highlights. So Lyme is an inflammatory infection. It causes inflammation and lives off the byproducts. It plays on an individual's weaknesses. It finds genetic vulnerabilities and previous injuries and exploits them. Severe trauma, whether it be mental or physical, can bring out dormant infections, and any hit to the immune system can cause a reactivation of the infection. So, I want to talk a little bit about the pathophysiology of spirochetes. So we're going to start out in the initial infection. We have the presence of the spirochete on an endothelial cell of the blood vessel, and this is where it all starts. So we have the stimulation of cytokines, and you will have a loosening of the endothelial cell junction, and this allows entry into the extracellular matrix. And this is where the spirochetes love to live because there are less immune cells and lots of collagen to eat. So we have three enzymes that break down the extracellular matrix and collagen. The first is hyaluronidase. So hyaluronidase is the enzyme that breaks down hyaluronic acid, and hyaluronic acid is a glycoaminoglycan that is widely distributed throughout the connective epithelial and neural tissue. If we stop hyaluronidase or block it, we can help to contain the infection and stop it from moving throughout the body and degrading the connective tissue. We can inhibit hyaluronidase using echinacea and ashwagandha. The next is aggrecanase. So, aggrecanase is an enzyme that breaks down aggrecan. Aggrecan is also found in the extracellular matrix as well as cartilage, and it's most abundant in the cartilage of joints. So, this is one of the reasons why Lyme is so good at causing joint inflammation. So, it breaks down the cartilage, causes inflammation, uses aggrecanase to release the nutrients that it needs to feed, and we can inhibit it using Japanese knotweed. So the matrix metalloproteinases or collagenases do exactly what it sounds like they do. They break down collagen. And there are a wide range of other pathologies that MMPs cause. But in general, just know that it's extremely damaging to both the brain and the central nervous system. So we can inhibit MMP 1 and 3 using Japanese knotweed, and we can inhibit MMP 9 using cordyceps and acetylcysteine, red sage, and Chinese skullcap. Okay, so I'm going to go through this section pretty quickly. It's just hitting the highlights of the cytokines. What I really want you to be able to see is that every single cytokine is inhibited by an array of different herbs. And you're going to see me go through a ton of herbs. Just know that you don't need to use them all. You can pick out the ones that are redundant and just focus on using those. And I always encourage people use the least amount of things possible to get the job done. So when the flagellin or the protein on the flagella, which is the tail of the spirochete, activates an inflammatory cytokine called nuclear factor kappa beta, this really is what causes the whole immune cell proliferation and inflammatory cascade. So this is kind of like the number one upstream driver of the inflammatory cytokine cascade. There are a ton of herbs here, as you can see, that will inhibit nuclear factor kappa beta. Japanese knotweed and Chinese skullcap are two of my absolute favorites. Okay, so next we have the MAPKs, and the MAPKs are going to activate the pro-inflammatory cytokines interleukin 6, tumor necrosis factor alpha, and interleukin 1 beta. We can inhibit those using Chinese skullcap as well as Japanese knotweed. IL-6 has a boatload of things that it does that is not helpful to the body, including driving fever, multi-organ injury, It stimulates the immune system's inflammatory response in both an acute and chronic state. It inhibits T regulatory cell production. IL-6 crosses the blood-brain barrier and stimulates PGE2 in the hypothalamus and affects the body's ability to regulate temperature. So I have so many patients that have an inability to regulate their temperature, and they have heat intolerance and cold intolerance. IL-6 also affects the hypothalamic pituitary adrenal axis, and it causes degeneration of neurons in the peripheral and central nervous system. So we can inhibit IL-6 using andrographis, kudzu, red sage, and again, Chinese skullcap. IL-8 is the primary cause of inflammation and the resulting cellular damage from a Borrelia infection. We can inhibit IL-8 using cordyceps and acetylcysteine, Japanese knotweed, curcumin, and quercetin. Interleukin 1 beta is an interesting cytokine. So it is the primary cytokine expressed in a Borrelia or spirochetal infection. And acutely, it is actually crucial for host defense and response to injury and infection. And it does play a beneficial role in resolving an acute infection or inflammation. When we have chronically elevated IL-1 beta, it is an immune amplifier, and it can actually lead to autoimmune and autoinflammatory diseases. It supports tumor development, growth, and metastasis. So we can inhibit IL-1 beta using cordyceps, boneset, Japanese knotweed, kudzu, red sage, and again, Chinese skullcap. Tumor necrosis factor alpha is elevated in many chronic inflammatory conditions. It causes issues with appetite, again, body temperature regulation, liver function, can cause severe brain and central nervous system damage. And we can inhibit tumor necrosis factor alpha using cordyceps, boneset, houtunia, Chinese skullcap, and red sage. Interferon alpha causes tissue inflammation, organ damage, autoimmune conditions, fever, fatigue, leukopenia, and it also stimulates indoleamine 2,3 dioxygenase, which causes a lot of other issues like the production of quinolic acid, which can lead to seizures and brain inflammation. We can inhibit interferon alpha using Japanese knotweed, red sage, and Chinese skullcap. Now, the indoleamine 2,3 dioxygenase, like I said, it breaks tryptophan down into quinolic acid as one of the three counterparts. IDO also decreases T cells, and it severely decreases melatonin and serotonin production. So this is why a lot of our patients are depressed and can't sleep. We can inhibit IDO using, again, Chinese skullcap. And then quin is a excitotoxic substance. It breaks down brain tissue. It can lead to seizures, and we can inhibit it using Chinese cat's claw, Chinese skullcap, melatonin, and selenium. And I want to note that Chinese skullcap, Scutellaria, contains high levels of melatonin. So it's actually helpful to give an extra dose before bed to aid in sleep, but also to help to decrease the production of quinolic acid so that we're not degrading our tryptophan and inhibiting its transformation into serotonin and melatonin. So this ongoing inflammatory cytokine cascade is really what leads to the imbalance in the immune system. So I want to note here, everything that I have gone through up to this point can be inhibited using a combination of Japanese knotweed, Chinese skullcap, and ashwagandha. So we can inhibit the enzymes that degrade the collagen, the extracellular matrix, and protect the endothelial cells. We can inhibit the entire inflammatory cytokine cascade, and we can balance the immune system. That's a lot with 3 herbs. Okay, so I want to very briefly talk about galactin-3. Galactin-3 is something that is going to be an upstream driver of inflammation. It helps Borrelia and other pathogens make biofilms in the body. And galactin-3, kind of like the interleukin 1 beta, it plays different roles in an acute versus chronic infection. So it is very important in an acute infection because it is like the fire alarm going off saying like, hey, there's either been an injury or there's an infection, and it recruits the immune cells to come in. So it literally orchestrates this initial immune response and stimulates some of the inflammatory cytokines to combat the infection. In a chronic situation, it's like the fire alarm never turns off. And even though the fire, like the big roaring, blazing, exploding fire has been kind of taken care of, it still is going to be calling everything, all of the other fire departments in, so to speak, even if like it's kind of under control. And what this does is it actually leads to fibrosis. It can lead to autoimmunity or over response of the immune system. And ultimately, it ends up suppressing an adequate immune response. So this galactin-3, like I said, is going to be part of the backbone or the scaffolding for the biofilms, which are the structures that spirochetes and other bacteria use to hide and evade the immune system. It can help other pathogenic microbes adhere to epithelial tissues, and it shields all of these pathogens from immune surveillance as well as other drug therapies. And it drives the cycle of dysbiosis, leading to systemic inflammation by breaking down the tight junctions in the gut and allowing for translocation of toxins, undigested food particles, etc. So I really think it is important to use a holistic plan of care when you are approaching complex chronic illnesses. So what do I mean by that? Using a whole body approach, healing the patient by correcting the immune system dysfunction, decreasing the inflammation, and ultimately making them inhospitable to the infections. And while you're making the body inhospitable to the infections, you are focusing on shrinking the bacterial, parasitic, fungal load. I truly believe that doing it this way will give your patient the best chance for eradicating the infections completely and having total healing of the body and restoring proper function to your patient. So I'm going to quickly go through what I call my 10B approach. And this is kind of just an approach. It's looking at all of the bases that I think are important when you are dealing with a chronic tick-borne or vector-borne disease. So number one, we want to do a background check. And what I mean by this is investigate all of the things that are filling the patient's bucket and causing them to be hospitable to the infection. So this is all of like the functional medicine, background things that we do, right? Like we look at hormones, we look at organ function, we look at micronutrient deficiencies. We look and see if there's food sensitivities. We look at digestion. We look at, the gut. We look at toxic loads, right? All of these different things. And obviously, we're not going to do this on every single patient. What we are going to focus on is going to come out of our very detailed history that we take from the patient. It's important to make sure that a patient's mindset is addressed. Patients who don't think they're going to get better are not going to get better. We need to look at their support systems. We need to look at stress. We need to look at sleep. We need to look at their social networks and support. And then we need to look and see, what biotoxins and toxins are we actually dealing with, and what is their ability to actually detox and eliminate these toxins, among other things. This could be a whole lecture in and of itself. Number two, sometimes we need to use Band-Aids. So I have patients come in who are barely functioning. They're on disability, they can't work anymore, and they're not going to be able to work a protocol that's given to them that includes a lot of, the lifestyle, therapeutic lifestyle changes that I do with patients. So, it's nice when we can use herbal Band-Aids, but, sometimes we need pharmaceuticals. Sometimes people need to be on psych meds. Sometimes people need to be on pain medicines. Sometimes they need LDN. But it's important to look at establishing or reestablishing a quality of life for your patient so that they can get through the day and they can work the protocol or the program that you're trying to do with them. Number three is block inflammation. This is really a 4-part step. So number one, we need to block galectin-3. We need to reduce its levels because, again, it is an upstream pro-inflammatory marker. We have to inhibit the inflammatory cytokine cascade that I went over with you. We need to block those 3 inflammatory enzymes that break down the extracellular matrix and allow these organisms to move and feed. And then we need to block the inflammatory food, chemicals, toxins, etc., from our lives. There is a specialized form of modified citrus pectin called G3M that is wonderful at blocking galectin-3. Now, Japanese knotweed and Chinese skullcap, like I said, together are going to inhibit all of these inflammatory cytokines. And using a combination of ashwagandha, Japanese knotweed, and Chinese skullcap, we can block the inflammatory enzymes that degrade the collagen, extracellular matrix, and endothelial cells. So we need to buffer stress, number 4. We need to correct the autonomic nervous system dysfunction and imbalance. Most patients, because they've been sick for so long, not to mention the crazy world that we live in, are in this perpetual fight or flight. And we cannot expect to be able to recover somebody's immune system if they have autonomic nervous system dysfunction. We see a lot of patients come in that have POTS, and it's like they're literally, their autonomic nervous system is just no longer functioning properly. So there are various nutrients you can see here that are helpful, but really doing like vagus nerve exercises, doing body work, grounding, earthing, breathing techniques, visualization, yoga, making sure that they're sleeping correctly, right? There's all of these other things that are super, super helpful in helping to pull someone out of this sympathetic dominance. Okay, number 5, we need to balance the immune system. I would say hands down, one of my favorite herbs for this is ashwagandha. If you need to increase immune system activity, astragalus is good. Cat's claw is good for increasing CD57 cells, and then overall immune system enhancement can be achieved using echinacea. Number 6, we need to rebuild the gut. So, again, I could go on and on about this, but using a good 4 or 5R protocol. So removing the things that are causing issues, whether they be food sensitivities, overgrowth of opportunistic bacteria, or fungus, eliminating the pathogenic bacteria, yeast, mold, balancing opportunistic bacteria, replenishing probiotics, healing the gut lining, replacing deficient micronutrients, using digestive enzymes if needed. This specialized form of modified citrus pectin works really, really well to decrease galectin-3 in the gut and decrease some of the inflammation in the tight junctions. SBIs are very helpful at binding and healing tight junctions. We, of course, want to eliminate gluten, dairy, and sugar and get our patients eating an anti-inflammatory and phytonutrient-rich diet. Intermittent fasting can be helpful to induce autophagy, getting adequate sleep, and stress management. So restoring GI integrity is really key And I want to point out that if you have increased permeability in the gut, you're going to have immune distraction and dysregulation. It's going to lead to systemic inflammation. You're going to have reabsorption of endotoxins. You're going to have an increased severity of the Herxheimer reaction. You're going to have an overburdened liver and detoxification systems. And overall, it's going to increase central nervous system inflammation and symptoms. So we also need to break down the biofilms. Modified citrus pectin is one of my favorite things for this. We can also use proteolytic enzymes like serrapeptase and nattokinase. And then there are a boatload of botanicals that help to break down the biofilms as well. We need to bolster detoxification. So again, number one thing with detoxification is making sure that our tight junctions have integrity. Because if we are just leaking toxins back and through the gut, you're really, you have an uphill battle here. We have to correct dysbiosis. We need to make sure that we have all of the nutrients needed to run phase 1 and phase 2 of our liver's detoxification systems. And then sometimes we need to use binders, and we also need to make sure that our routes of elimination are functioning properly. Also, when we're talking about detox, we need to stop the exposure, right? So we have toxins in our air, in our water, in our food, in our self-care products, in our cleaning products, not to mention all of the biotoxins as well. So we need to really look around and evaluate our environment and stop the toxins from entering the body. Again, we need to make sure that we have all of the nutrients that we need to coordinate phase 1 and phase 2. If phase 1 is working faster than phase 2, we're going to have this build up of these intermediate toxins that are often more toxic than the toxin started on its own. So we want to make sure that we are coordinating phase 1 and phase 2, not pushing phase 1. Again, just another slide here to show the role of the GI system in detoxification. And then there's a couple studies here showing the ramifications of increased permeability when it comes to toxicity and how these toxins can lead to increased cytokine production and oxidative stress when they are being dumped back into systemic circulation. Super important to note that there are so many self-care interventions. I love Epsom salt baths, far infrared sauna, dry skin brushing. Okay, and then it's also important to note here that a Herxheimer reaction is very real. And it's not just a temporary worsening of symptoms. Yes, that is what your patients experience. But I want you guys to realize that it is also a transient increase in inflammatory cytokines. And so when someone is herxing and their inflammatory levels are going up, this is causing more cell damage and it is causing oxidative stress. And it is actually making the person more hospitable. So if we prime the patient and we go through all of these sort of steps and we work on healing the gut as best we can when someone has an active, inflammatory infection that's breaking it down, you can prevent herxing. But once it's already happening, there's 4 main points. Number 1, we want to bind the LPS, which is the part of the cell membrane that is being broken down from the dying bacteria and sort of kicking off this inflammatory cytokine cascade. We want to focus on detoxification and detox these LPS once we've bound them. We also want to focus on alkalinizing the body. And we want to use anti-inflammatories. So bind, detox, alkalinize, anti-inflammatory, 4 steps to dealing with a Herxheimer reaction. And I highly recommend that you're doing this on an ongoing basis. Okay, and finally is blast the bugs. I leave it last on purpose. I want to talk about, some of these herbal medicines in depth, but also it's like we cannot tolerate the blasting of the bugs if we haven't addressed all of these 9 other bases before we get there. I mean, we can, but a lot of times you'll see your patients get a lot worse and not tolerate the treatment. So there are a multitude of studies showing the effectiveness of botanical medicine. There are 4 wonderful books on healing Lyme and co-infections written by the late Stephen Harold Buhner. I wouldn't know anything of what I know now if it wasn't for that man and his work. So I can't recommend his books enough. This study in particular showed that cryptolepis, black walnut, sweet anise, cat's claw, and Japanese knotweed had potent activity against not only the Lyme disease bacteria in its growing and non-growing stages, but also the dormant persister forms, which are not killed by current Lyme antibiotics. So my 7 most used antimicrobials for Borrelia are Japanese knotweed, cat's claw, Chinese skullcap, sweet anise, cryptolepis, hatunia, and black walnut. And I am going to give Vibrant permission to distribute the PDFs of my slides because I am getting short on time and I don't have time to go through everything. So you can look through all of these side benefits that these herbs have. Like, for example, Japanese knotweed is also anti-inflammatory, as hopefully you've learned today, as well as immunomodulant and immunostimulant and neuroprotective. And so this is in addition to it being a powerful antibacterial. So I'll let you look through all of these here on your own. And now I'm going to give you my sample herbal protocol for Lyme. And it is a sample herbal protocol, and it's not to be used alone without doing all of the background work. But basically, it would look like 1 teaspoon of the specialized modified citrus pectin or G3M 3 times a day, a half a teaspoon of ashwagandha 3 times a day, a fourth of a teaspoon of Japanese knotweed 3 times a day, a fourth of a teaspoon of cat's claw 3 times a day, a half of a teaspoon of cryptolepis 3 times a day, a fourth to a half of a teaspoon of Chinese skullcap 3 times a day, a fourth of a teaspoon of sweet anise 3 times a day, a fourth of a teaspoon of black walnut 3 times a day, and 600 to 1200 milligrams of grapefruit seed extract twice a day. And then I would consider others depending on individual symptoms. I use liquid extracts of whole herbs. I am very passionate about using whole herbs and not just extracting certain constituents. Herbal medicine, really old school herbal medicine, it's like all of these constituents work together. And so when you are doing an herbal tincture where you have extracted these constituents using alcohol and water, you're going to get a specific combination of these constituents that do what they're supposed to do. So I know this sounds like a lot, but when you actually mix it all together, you're looking at less than a tablespoon that the patient is easily able to add to water, or if they mix it with the lime flavored G3M, they make what I like to call a little limerita, and they can drink it down very easily without having to swallow numerous capsules. So I'm going to quickly go through the pathophysiology of Babesia and where the herbs intervene, and then I'm going to get to our case study. So it's important to note that Babesia invades endothelial cells that line blood vessels, as well as red blood cells, and it infects the spleen and the liver. Nitric oxide is our body's innate chemical in fighting a parasitic infection, and cycline-dependent kinases are necessary for Babesia to be able to replicate itself. So replication cannot occur without them, and we can inhibit them using sweet anise, Chinese skullcap, licorice, ginger, as well as magnolia and some other herbs here. So in an acute Babesia infection, the innate immune system should increase interleukin 12 and 18. This will increase natural killer cell production. And natural killer cells are going to increase interferon gamma, as well as stimulate inductible nitric oxide synthase. And together, they're going to convert arginine into nitric oxide. Nitric oxide will surround the endothelial cell or the red blood cell in this instance and release a gaseous cloud, which will kill the parasite. Now, in a chronic Babesia situation, you have the B cells stimulating the release of interleukin 10 and interleukin 4. Interleukin 10 is going to increase transformative growth factor beta, which increases L-ornithine, which supports the parasitic reproduction. IL-10 is also going to stimulate arginase, which is the enzyme that breaks down arginine. IL-10 also blocks interleukin 18 and interleukin 12, which in turn suppresses natural killer cells and interferon gamma. And all of this together is going to block nitric oxide production. So for a successful resolution of Babesia, there are several sources that show that this is dependent on the spleen's production of interferon gamma, the body's production of nitric oxide, increasing interleukin 12, and decreasing interleukin 10 and interleukin 4. So goals for successful resolution of Babesia are going to include inhibiting the specific cytokines and modulating the immune system, as well as supporting and protecting the areas of invasion, and then using anti-babesial herbs. So immune modulation, balancing Th1 and Th2, ashwagandha, hands down, my favorite herb for that. Suppressing IL-10 using Chinese skullcap and ashwagandha. Suppressing IL-4 using astragalus. And inhibiting TGF-beta using either astragalus, sweet anise, or red sage, as well as Chinese skullcap. We need to inhibit the generation of arginase, and we can use this using Chinese skullcap. And then we need to increase interleukin 12 and interleukin 18, as well as interferon gamma and nitric oxide production using astragalus is my favorite. So I want to show you where the herbs intervene here. So if we bring in ashwagandha, ashwagandha is going to block IL-10, which is going to unblock IL-12. That will unblock interferon gamma and block arginase production. Then we bring in red sage. Red sage is going to increase inductible nitric oxide synthase. And then if needed, we bring in arginine, and then we can have that conversion back to making nitric oxide. We can bring in either astragalus, sweet anise, red sage, or Chinese skullcap to inhibit IL-4, as well as IL-10 again, and that will block transformative growth factor beta and L-ornithine production, which stops supporting parasite reproduction. So I'm going to let you look through these on your own for the sake of time. Here is another study that was done looking at the effectiveness of botanical medicines against Babesia duncani. You can see that Chinese skullcap and cryptolepis were of the top performers. And here is a sample herbal protocol for Babesia. And putting it all together, I want to quickly walk through the rationale behind this. So this is if I were treating a simultaneous Borrelia and Babesia infection, which I have a case study for in a moment to go through. So I would modulate galactin-3 or lower galactin-3 levels using modified citrus pectin. I would balance Th1 and Th2 using ashwagandha. I would give the body back its innate ability to destroy microorganisms using by increasing nitric oxide using red sage. I would inhibit the inflammatory cytokine cascade using Japanese knotweed and Chinese skullcap. I would protect the endothelial cells using Japanese knotweed. I would increase natural killer cells using cat's claw. And then I would use various proven antimicrobials like cryptolepis, sweet anise, teasel, black walnut, antivirals if necessary, like Hotunia, Chinese skullcap, and Iastis. I would do pre and probiotics. And of course, I would detoxify, support the routes of elimination, replenish micronutrient deficiencies, get the person on an anti inflammatory diet, work on stress, movement, sleep, autonomic nervous system balance, etc. So, I strongly believe that if you understand the infection, how it lives and thrives inside of the body, how it makes us hospitable, and then you understand your particular patient's weaknesses and their pieces of the puzzle, and you understand the mechanism of actions of the various medications, herbs, nutraceuticals that are available to you, you can kind of marry them all together and create an intelligent, effective treatment plan of your own instead of relying on protocols. So I strongly support approaches. But I really try to stay away from one size fits all protocols because, in my opinion, there just really isn't one. Okay, so I'm going to go over a case study with you. This is actually my son, and I chose to use him for a multitude of reasons. Number one, because his tick, the tick that I sent out to be tested, matched Vibrant's results as far as what he came back positive for down to the species. And also, obviously, he's my son, and I know his case like the back of my hand. And for reasons that I'll get into, we chose to treat him for both Borrelia and Babesia herbally. And a lot of that has to do with our wonderful FedEx who had originally lost his tick. So his family history is his dad has a history of tick-borne disease. He's heterozygous for MTHFR. He is intolerant to gluten. His grandfather has inflammatory bowel disease, autoimmune disease. I have a previous history of tick-borne disease, hypothyroid, and I'm homozygous for MTHFR, the 1298. So previous to being 5 years old, he was completely healthy. He had a normal vaginal delivery. He was nursed exclusively for 6 months, 2 years total. He had never been on antibiotics. I had made him be gluten-free, dairy-free since birth, and we ate primarily, a very healthy organic diet. At 5 years old, he sustained a tick bite. The tick tested positive for Borrelia species only. I immediately started an herbal protocol with him. The tick came back as positive for Borrelia species, and we decided to put him on amoxicillin for 4 weeks. He got on that amoxicillin within 3 days of the tick bite. We never tested him. He never had a rash. He kind of complained of some growing pains in the beginning. He did wet the bed twice, which was completely out of character for him. And I did some rifing with him. A colleague of mine does rifing, and I kept him on a pretty significant herbal protocol for 9 months. And I didn't test him before or after that. So then the next year, I dropped him off for his little kindergarten graduation, and he definitely did not have a tick attached to his face right here when I dropped him off. And we came back like an hour later for the ceremony, and I saw it from across the room. He had a little nymph tick right here on his face. There is no way that that tick was on him for more than an hour. And we sent the tick out, and I put him on herbs immediately. And so the story is, I'll make this very short for the sake of time. Somehow the tick got lost. It took us 10 days to get his results back. And I had started him on herbs immediately. So he had no symptoms at all. He had been on the herbs. The tick had been attached for less than an hour. And so I really thought when we got the result back that the tick was going to be negative. But lo and behold, it was positive for Borrelia general species, sensu lato, and Babesia macroti. So at that point, Oh my gosh, it could be such a long conversation. I'm just going to tell you, I felt like we were outside of the really studied treatment window. He wasn't symptomatic. I decided to treat him solely using an anti-babesial, anti-spirochetal Lyme protocol. It's not something that I would ever do with a patient, but that's the route that we chose to use for my son. So we tested him 4 weeks later because, as I hope you all know, it takes at least 3 weeks before you're going to have antibody production. And when we got the test back, he actually showed antibodies against Babesia macroti as well as Borrelia burgdorferi. I had just done a micronutrient panel and food sensitivity panel about 2 months earlier. And so I had all of those results back and also had proof that his white blood cell count was normal. So I'm going to go through his various labs here. So here is his tick from tickreport.com. You can see that the tick was partially fed. So I believe that he was one of these cases where the tick had already partially fed on something else before it attached to him. And this is why both Borrelia and Babesia were transmitted to him so quickly. You can see on the bottom here, so July 2022, this is when I sent his blood work out to be tested. So a month after the tick bite, you can see the white blood cells were low, neutrophils were low. And I'll come back to, the August 2023, which is when I rechecked him after we were done treating a year later. Here's his micronutrient panels. So you can see the columns over to the left are his results from April. Luckily, I had already been supplementing him with his basic supplements since April by the time he got bit in June. What you can see in the column to the right are his actual August results. So again, this is after he had been treated. And you can see that most of these, and again, I look at the white blood cell level because that's intracellular level. I don't really care what serums are. To me, serums are kind of an expensive diet diary of what you just ate or took as a supplement in the 48 hours leading up to this test. So I want to know white blood cell. I want to know what got into the cell. And I want to know, kind of the accumulation of nutrients over the several weeks leading up to this test. So here are his various nutrient levels. And then here are his tick 1.0 results. So July of 22, you can see kind of like the black box around that. So you can see his C6 peptide was at a 15 for an IgM. His 23-25 was at a 17, and his 45 was at a 21. And so even though overall this test was negative, I'm looking at the fact that there's an IgM to the C6 peptide, and I'm going to take that seriously. And then if you look at the current results, so that was the August 2023, you can see that the IgM was gone in August, as well as the 23-25, which is one of the very specific bands. And then his 45 had gone from a 21 all the way down to a 12. And I will get to the protocol that I put him on, his protocol, in a moment, but I just want to go through the comparisons here. So for Borrelia afzelii, you can see his July 2022, he was up at a 17. That came down to a 13. And by the way, this is just something that I look at. I consider IgGs that are a 15 or under as potentially memory cells. So if an IgG is over a 15, I'm going to look at that as a chronic active infection. Obviously, if there's any level of IgM, I look at that as active infection. So for Spilmani, you can see the IgG was a 13 in 2022. And then when I repeated, it was down to an 11. The Zangtensis was a 19.9. That came down to a 12. Now for the Californensis, so it started up at a 19.7. It came down to a 13. I had decided, since this was the only IgM that was there, that I was not going to continue treatment because everything else had cleared. Here you can see his Babesia macroti. So the 32 was a 17, that came down to a 15. The whole cell sonic hit was up at a 23, that came down to a 13. He also had Bartonella, but I believe that I gave that to him in utero. We had never had another tick that tested positive for Bartonella. And, if it were anyone else, I would say, well, sometimes you just don't see all of the ticks. I can tell you this poor kid has had a tick check literally every night of his life before bed. And there were not tick bites that I did not know about. He had food sensitivity testing. So previous to getting Lyme disease in 2022, he did not have an egg allergy. And after this, he ended up being very sensitive to both egg whites and egg yolks. He's always had the peanut issue and an issue with green peas, and they are still there. I actually just did a test and got it back last week. So his instructions were taking, it's called multi-core powder. It is a very high quality activated B vitamin, multivitamin, multimineral powder. I put him on 1,500 milligrams of EPA and DHA, so 3,000 total. I put him on 4,000 IUs of vitamin D3. I put him on alpha choline, 600 milligrams twice a day. I put him on phosphatidylserine, 100 milligrams per day. Vitamin C, 1,000 milligrams twice a day. And this is because of his micronutrient deficiencies that we saw on the Vibrant micronutrient panel. Now, keep in mind, this is my kid, right? So I have access and I'm going to act like a crazy mother. I put him on pretty much every single herb. I can safely say I've never put any patient on this many herbs. But I did for him because, again, I wasn't going by the standard of care and putting him on atovaquone and or doxycycline. So again, another reason why I wanted to share his case study with you, because this isn't something because of malpractice and standard of care that I would have ever recommended to a patient. But basically, we put him on all of these herbs. I mixed them all together. He had roughly about a tablespoon and a half's worth. He did it 3 times a day. We mixed it into his G3M, and he took it 15 minutes before breakfast, before lunch, and before dinner. At his little Montessori school that he goes to, he actually would mix this up and take it himself. So for anyone who says, oh my God, like a kid is never going to do this, he's 6. And he did this. And not only did he take it, but he mixed his G3M with a tablespoon and a half of his herbs, and he took it at school under the guidance of his teacher. And he did it for an entire year. So, these are the same test results, again, just showing you that basically all the IgGs were down under a 15 and all of the IgMs had cleared. Now, I do want to make it and his white blood cells had gone back to normal after we were done treating. So I want to make it clear, he never had any symptoms. Had he had symptoms, you know what I mean, then I may have considered a different course of treatment. Showing antibodies to these infections is showing an immune response. It's not showing that he had a raging, devastating infection in his body. It's showing that his body was exposed to these pathogens. I do truly believe that the herbal protocol that I put him on and the fact that he was put on it within an hour of getting bit was able to not only effectively stop these organisms like from replicating and taking over his body, but also helped him to never end up creating that hospitable environment inside of the body that I'm talking about. So, anyways, for what it's worth, there you go. I hope that this was helpful to you guys. And if anyone has any questions, I am so sorry. I know that I've gone over, but I'm happy to entertain any questions.
Thank you so much, Dr. Hinchey. I learn so much every time that I hear you present anything. So I really appreciate your work on all of this. So we do have a couple questions now. Some of the questions were addressed, so I might just skip over those in essence of time. But I can put them up on this screen, and hopefully, Dr. Hinchey, you can see them on the screen. So we have a couple questions asking about prevention. If people, especially going into the summer months, do you have ideas on prevention?
Yeah, so I'm assuming that this questions means like preventing the bite in the first place.
I would
Not
assume
once.
so,
Okay.
yes.
So
Yeah.
yeah, I mean, I would say probably the number one thing that you can do is tick checks, right? So if you can do tick checks and you can catch that tick when it's still crawling on the body before it's had the chance to embed itself, so anytime that, the kids have come inside from being anywhere near the woods or even out in the grass, around playscapes, anywhere where there's leaves and shaded area, as well as, tucking socks over pants and, that whole thing. I would say I like essential oils. I like cedar as far as putting it on the body. I think it depends on your environment. If you're going out to somewhere that there's a lot of ticks, then I would even put permethrin on the soles of the shoes or buy insect shield socks or, go to that extreme. I hate toxins. I hate toxins. But 3 times a year, we spray our property with like the heavy duty killers because it's like we just need to get back to a baseline. And then every month we have a company come and spray with organic cedar. And, I just feel like preventing that bite is really key in preventing dealing with any of this.
Wonderful. Thank you. I'll just ask a follow-up question because I'm curious. Do you recommend any type of preventative herbal protocol, like going into the summer months if you know you're going to be hiking in the woods a lot, or just kind of tick checks and then have an herbal protocol on hand if you need it?
So yes and no. I the way that my family handles it, which is what the question was, I tend to just be way more vigilant with the tick checks, and I always have it on hand. Like we have a tick preparedness kit with us all the time. Making sure that your immune system is healthy, as I say while I'm sniffling my cold away. Not eating sugar, eating organic, trying to do all of the things that are going to make us less hospitable so that if we actually do sustain a bite, we're not in rough shape already and we're not already inflamed because these infections will go to inflammation like a magnet so they can feed.
Yeah. Wonder. Okay. Yes. Awesome. Thank you. Um, Several questions about protocols, but I think you may handled all of those. So I'm going to go ahead and say, are the lists of herbs that you gave combination supplements available, or usually just using them as separate herbs and then combining yourself?
So there are a multitude of companies that have various combinations of herbals put together. And there are a multitude of companies that have individual herbs as well. I prefer the individual herbs because it gives me the freedom to customize what I'm doing with the patient. And, if they have viruses or they have Babesia or they have Bartonella or they have Lyme, I'm going to pick, these individual herbs without putting them on too many. I'm going to pick the ones that are overlapping, right? And have these other side benefits. That being said, yes. So like at Lymecore, I mean, I kind of assume that's where we're going with this. So like at Lymecore, we have various formulas put together. We have ASAB, which stands for as soon as bit. It contains all of the herbs that shut down that inflammatory cytokine cascade, inhibit the enzymes that break down the extracellular matrix, protect the endothelial cells, etc. And then we have our ASAB2, which is the broad spectrum antimicrobial. So antiviral, antibacterial, and anti-parasitic and protozoal, because, in the beginning, when you have no idea what that tick contains, you can just start the ASAB 1 and 2, and you're kind of covered. I mean, the best you can be covered herbally. And most of the herb, like 12 out of the 14 herbs that I put my son on, are going to be in that combination of those two products. Then we also have Borrelia core, Bab core, and Bart core, which have, specific herbs geared towards hitting kind of like the main pathophysiology of those infections.
Wonderful. Wonderful. We did have a question of where, I can't find it now, but I know it was here. Where is Lyme core available? Directly from your website, right?
Yeah, so you can go to lymecore.com.
Okay.
And it is there. There's a multitude of practitioners that are currently using Lyme core as well. So if you're a practitioner, you can set up a wholesale account. And if you are a patient and you're listening, make sure that you get your practitioner's code, because that will actually save you on the retail price, because we have a professional retail price that patients can get from their practitioners.
Very good. Okay. There is a question about time on protocols, but I'm going to go ahead and just kind of lengthen that out and just say, at what point do you either decide to stop a protocol or retest, or, how does that work in your office? Because we know every patient is different.
Right. So I'm going to assume we're talking about chronic Lyme or chronic tick-borne disease. And when we are, then I would treat the patient until they have been symptom-free for 2 solid months. Not only do I want them to be symptom-free, but let's say that they have, some weird symptoms that could be explained by anything. If every time I see them, let's say it's a little bit of fatigue, but let's say that their fatigue is less, in January than it was in November, then I'm going to keep going. So I'm going to keep going until everything is stagnant and everything plateaus, because we want to make sure, if they're still herxing, right, then you're still killing something actively. Or the converse, if they're still getting better and better, it's like they're still healing. And so my goal is to make sure that I've recovered the immune system, because in the end, the immune system is what has to stop this infection from replicating or hold it into remission. And so once the patient has been symptom-free for 2 months, I will repeat the tick 1.0 or IGeneX, whatever the patient came in with, I want to replicate that same test. And I want to make sure that all of the IgMs that were present in the beginning are gone, but also that they don't have any new IgMs. Because to me, IgM means that there still is an infection. And I know that there are studies, a couple, that had showed persistent IgM elevation, but that was in a small percent of the population. And then you always have to kind of say, well, were they still infected? Because there's no way to know, you know what I mean? So I like to make sure that in a perfect world, all IgMs are gone and all IgGs are going to be very, very low, to the point that I can make a case for them being memory cells. And then I will take them off their antimicrobials first, and I will keep them on the supportive herbs. And then if they don't relapse after about 6 to 8 weeks, then I will start pulling the rest of the herbs out in various groupings.
Wonderful. Great advice. Wow, awesome. All right, we're going to go ahead and stop there. I think we covered majority of the questions that were there. This was a wonderful presentation. Thank you so much, Dr. Hinchey, and thank you everyone for joining today. You will get a copy of the recording, a PDF of the slides, and those will be going out through your emails. So thank you so much and have a wonderful day.
Bye. Thank you.